Hello, it's Teresa with Path to Passing. Today we are going to talk about the carotid, which in ultrasound is one of my favorite studies to scan. Let's talk about it. So the carotid, I went ahead and drew a picture of your aorta, the ascending and the arch. That's what you need to focus on when you are beginning to learn about the carotid. So in my older videos, I told you what the aortic arch is, what vessels come off of it, but let's go ahead and summarize. So you have the aortic arch, you have the brachiocephalic trunk, you have the common carotid artery on the left, and then you have your left subclavian artery. That's your trunk. That's your starting point. But now, to understand the carotid, you need to know that the right common carotid artery comes off of the brachiocephalic trunk or nominate, depending on what you guys use in your practice. So you have the common carotid artery here, and it then splits into the two further vessels. So the common carotid artery, when you use the word proximal, mid, distal, proximal just means closest to the heart. So you know that your heart is, in this region. Proximal is going to be down here for your common carotid artery. And then that would be like your mid segment. Here would be like your distal. And then here would be your bulb, okay? Your bulb. And literally it's exactly what it says. It bulbs out. And then the bulb usually continues into your ICA, which is your internal carotid artery. And then you have your ECA, which is your external carotid artery. Okay, the difference between your internal carotid artery and your external carotid artery is going to be first its location. The external carotid artery tends to be more medial, so it's more towards the center of your body, whereas the internal carotid artery tends to be more lateral, which is towards the outside of your body. So here you have your ICAs out here and you have your ECAs more medial. Also note that your ECA, your external carotid artery, has branches, okay, within the neck. So the first branch off of the ECA that we see on ultrasound will be your superior thyroid artery. And you have it, of course, bilateral, which just means on both sides, okay? So again, you have your arch, brachiocephalic trunk, right subclavian, common carotid on the right, left common carotid, and then your left subclavian, okay? Which then splits and goes up to your neck vessels. So another thing that I want to point out is, I know a lot of times we talk about ICA and ECA and we talk about branches. The ECA has branches in the neck. The ICA does not. However, the ICA does have a branch, okay? It does have a branch. It goes into your ophthalmic artery, your eyes or whatever. But in the neck, the ECA has its branches. So there we have that. If you don't understand the aortic arch, and go ahead and watch one of my other videos, which goes over just the aortic arch. So you have your ascending aorta, aortic arch, which then goes into your descending or your thoracic aorta. Okay. So then I got some questions over here that I want us to answer together. Let's do it in purple. Okay. For some reason, I like purple these days. So your ICA supplies the brain. Okay, your internal carotid artery supplies the brain, whereas your external carotid artery supplies your face. Okay, ICA supplies the brain, your external carotid artery supplies the face. Okay, which one has 8 branches? So we know that we already see a branch here, which is your superior thyroid artery. We know that there's no branches for the ICA in the neck. So one could guess that it's going to be ECA, but ECA is the correct answer, okay? The ECA has 8 branches. We will go over the branches of the ECA in the following video, but on this video, we're just going to try to stick to differentiating the ICA from the ECA. So next, which one has low resistive flow? Low resistive flow, that is going to be your ICA. And then which one has high resistance flow? Go ahead, guess. I'm sure you know the answer. It's not many choices. It is the ECA, okay? The ECA. So I hope that you now better understand the carotid and its branches into the ICA, ECA. Go ahead, take a screenshot if you need to. Again, thanks for watching this video. Like, comment, subscribe, and I'm so happy to have you here on my channel.